Hello, welcome to the EURACTIV interview series. I'm Karolina Zbytniewska, Chief Editor at EURACTIV Poland, and our guest today is Stella Kyriakides, the EU Commissioner for Health and Food Safety. Pleasure to have you here.
It's a pleasure to be with you, Karolina.
Madam Commissioner, in the most EU countries, the fourth wave of the pandemic has started, and the numbers are looking actually quite bad, despite we have a third booster shot made available. How would you assess the preparedness of the EU health systems and the populations taking the experience of almost 2 years of the pandemics?
We're not where we were this time last year in 2020, because we now have safe and effective vaccines which are being used across all the European Union. I think it's very important to understand that what we have been saying for several weeks is that we needed to continue increasing our vaccination coverage and at the same time keeping in place non-pharmaceutical measures such as mask wearing and social distancing when we saw that the case numbers were rising. The level of preparedness of member states in terms of the last, I would say, 1 year has changed significantly. And I think that the important thing here to understand is that we have now available vaccines for all the European citizens. So my message needs to be and will always be that we need to continue to vaccinate, especially as we are changing seasons. We are seeing the weather change. People are mainly indoors. We need to increase vaccination coverage, wear masks, keep social distancing so as to ensure that we are as safe as possible.
On the 31st of August this year, when the EU reached the crucial milestone of 70% of adult population being fully vaccinated, you said that the EU could not become complacent, but instead that there was a need to close the immunity gap. How does the EU actually plan to help to bridge the vaccination gaps between not only member states, but also within the member states between different social groups, including, for example, migrants, and how the EU is supporting, for example, Bulgarian and Romanian populations with just around 30% of Bulgarian adult population and around 40% of Romanian adult populations being vaccinated.
We had placed the aim to reach 70% of the adult population of the EU fully vaccinated by the end of summer. And we got there. We now have over 75% of the adult population fully vaccinated in the EU and just about 65% of all the population. But there is no doubt that with the Delta variant, we need to go higher. We have member states, you mentioned some of them, that have lower vaccination rates, and we are seeing that they are facing more pressure on the health systems in this fourth wave. We must not forget, though, when we're discussing where we are today, that the vaccines are protective, because what we are seeing is that those who are vaccinated have less chance of serious disease, less chance of being in an ICU, and lower rates of mortality. So vaccines are protective. What we have done from the beginning, and what I have done, is I have visited several of the member states which had low vaccination coverage. We have reached out to them, and the ECDC, European Centre of Disease Prevention and Control, is working very closely with them to support them, to increase their vaccination rates, and also to see what challenges they are faced. We are here to support and deal with the different challenges that member states face. And also the civil protection mechanism has been mobilized by several member states to have support for medical equipment and for medicines. So there is no one-size-fits-all answer, Karolina. different member states, and you are right, even within member states, they face different challenges in terms of vaccination coverage, and we need to address this according to the target populations in different ways. Different for migrants, different for for the elderly. We need to address issues to do with misinformation, and we are working with all the member states in this way. But I would say that the message to share is that we do know that the vaccines that we have now protect against serious disease, hospitalization, and mortality, even against the Delta variant. And this is an important message for citizens to hear.
Thank you very much. And as for the challenges that you mentioned, 30% of nurses have dropped out of the profession within only the last 2 years. What is the EU doing to build a sustainable and resilient health professional workforce? And how can the recovery and resilience plan support frontline health professionals, so not only nurses, but also doctors and pharmacists who are involved in the vaccination delivery?
The health workforce, the doctors, the nurses, have been at the front line of this pandemic from the very beginning, for now for 22 months. And I take this opportunity to express our thanks to them and our gratitude for the unbelievable level of dedication and sacrifice that they have been showing from the very beginning. It is a fact that we need to build up stronger health systems within the EU. And the member states have been working towards this, and we are supporting them through the new EU for Health programme, which has a 5.1 billion euro funding, and through the Recovery and Resilience funds. We need to work on building stronger health systems, but also to invest in the education, in the further training of doctors and nurses, to be able to support them so that they can deliver. The pandemic has shown us that, unfortunately, health systems were not as strong or were invested in as much as we should have had in the past. And this is now, I believe, has changed in all the member states. Everybody realizes we cannot go back to what it was before the pandemic. And this is why we have also come forward with proposals for a very strong European Health Union. And part of the strong European Health Union involves supporting and building up on the resilience of the health systems of our member states. We need to do this not only for the cases of COVID, but also for non-communicable diseases. We need to ensure that citizens have access to best health care for all diseases. And this is important, and is part of the European Health Union policies that we are putting forward together.
So we know that the pandemic has dramatically changed the way the EU and the member states collaborate on health, and you mentioned the European Health Union. So can you tell us a bit more how this European Health Union is developing, and about the new Health Emergency Preparedness and Response Authority? To what extent will some of the basic aspects of HERA be altered after a list of concerns was forwarded to the EU institutions by 19 European health organizations on November the 3rd?
The strength of what we can do together and the importance of solidarity and coordination is shown in the EU vaccine strategy. The EU vaccine strategy is the best proof that when we all work together, the results we can achieve are really so important and excellent. We have vaccines available to all citizens in every member state, big or small, at the same time. And we're moving this way, all 27 together, for the EU therapeutic strategy. But it is also very clear that many of the solutions we put together to deal with the pandemic in 2020 were ad hoc solutions. We cannot be dealing with cross-border health threats and public health crises with ad hoc solutions. We need structural solutions. And this is why President von der Leyen last year in his State of the Union speech spoke of the need for a European health union. We put forward the proposals. They have several different pillars. One is to strengthen the mandates of ECDC so it can deliver what we expect it to deliver in case of a crisis. The second is to strengthen the mandate of the European Medicines Agency, EMA. Both agencies have done exemplary work, but we need to be prepared in a different way. We are working towards a new pharmaceutical strategy, and I know that this is of great concern to many member states, so that citizens have access to medicines and innovative medicines affordably at the same time. And we are working towards a new Europe's Beating Cancer plan. HERA is a new authority that is now in the process of being set up. It will be up and running fully by early 2022. And it has two, I would say, important aspects. One is the preparedness mode. So it will be an authority that will be able to have a surveillance mechanism, a preparedness mechanism. So when there is no emergency, we are surveying to see what could be appearing, what we need in terms of medicines, in terms of vaccines. It's preparedness. But it will have also a crisis mode that will be able to immediately kick in a very quick reaction to respond to an emergency. Member states are fully involved in both and in HERA, and we are working with the member states in order to put this forward. I believe that we all understand that throughout this crisis and in our proposals of the European Health Union, we're working very closely with the European Parliament and with the member states as a commission, because we all need to work together. But we need to be prepared in a different way for future public health crises. And HERA is the new authority that will allow us to do this. So the discussions are ongoing, and we hope that by January of 2022, HERA will be a fully functioning authority where together with the member states we can move ahead and really deliver what citizens expect from us.
So we can say that HERA is a kind of a one big lesson learned of the pandemic, and also with its preparedness and the crisis mode.
I don't say that it's one big lesson learned, because we are still in the pandemic. And this is a pandemic where we are every day seeing new situations. But what we do know is that we need to have the structures in place to not only be able to deal with a crisis when it happens, but to be surveying, to be prepared. And this is why the European Health Union has many different pillars. And HERA is an authority which allows us to bring everything together. So really we are going to be better prepared in the European Union and also be able to respond effectively quickly. It has different aspects to it, involving research, involving surveillance, involving seeing the capabilities that we have to react, and then a very quick response mechanism. So together with the strengthening of ECDC, strengthening of EMA, a new pharmaceutical strategy, we are going to be all together building a European Health Union that will deliver for citizens what they rightfully expect from us in the area of public health.
Now I would like to ask you about the role of civil society, because you not only once mentioned the importance of its contribution to the EU's and member states' policy making. So what is, in your view, the role of NGOs, and how does the Commission cooperate with them to promote vaccination?
I'm a very firm believer of the role of civil society, and we work very closely with NGOs. We need to have all stakeholders involved when we are planning and moving forward in the area of health. And throughout this last almost 2 years now, all stakeholders, NGOs, civil society, industry, everybody has been involved in building up the proposals. NGOs have a very important role to play because they represent many times the viewpoints of citizens. So in the area to do with vaccinations, it's not only about COVID vaccines, it's about all vaccines. We have seen that because of the pandemic, other vaccination programs in the member states have also been impacted. Thankfully now, we are seeing that these gaps are being covered, but we're working very closely with civil society to make sure that vaccination programs which protect, and we know that vaccines protect, are able to respond and come back to the levels they were before the pandemic, and also working with civil society to ensure that we vaccinate as many citizens as possible for COVID-19. And here, NGOs have a very, very important role to play. And as a Commission, we involve discussions with NGOs and with different stakeholders at every step of the way on all the policies that we build.
Now I would like to ask you about access to other vaccines than these for against COVID-19, because according to the WHO statistics, the coronavirus pandemic has severely disrupted access to other vaccines. What can be done from the European Commission's level to ensure that the routine immunization levels rebound and that routine immunization continues to be delivered during the pandemic?
As with many other services delivered relevant to other diseases, for example, we know that the services delivered for cancer patients have been severely impacted by COVID-19. As with those, I've been working very closely with the ministers to ensure that all the services offered in terms of the health sector go back to what the situation was before the start of the pandemic. And it's important that vaccination programs for especially childhood diseases continue to give the level of protection that we had before. I will say here that we are now facing, as you know, a challenging situation in many member states with the ongoing increase of COVID-19 cases. So it's important that with all the ministers we work together in order to ensure that all the other services for other non-communicable diseases, vaccination programs continue to offer the level of protection we would want them to. So this is, I think, a very important message that all vaccines protect, and we need to continue with the rollout of our vaccination programs, not only for COVID-19.
Thank you. What is next for the EU on the health agenda? How will the EU contribute to making national health systems resilient and more prepared for the many challenges that we face, including not only the ongoing pandemic, but also simultaneous pandemics of non-communicable diseases and mental health that Europe is facing?
But as I said, through our new proposals on the European Health Union, we will be putting into place many structures that will be dealing with the area of health in a different way. Through our new program, EU for Health, we will be working with member states very closely in order to have strategies in place that will strengthen their health systems, but also to specifically approach other diseases. We have a Europe's Beating Cancer plan. This is a plan already in motion that will tackle the many issues that member states are dealing in the area of cancer, to do with screening, with early diagnosis, a lot of actions on prevention, which is very important. And you mentioned mental health. This, I'm very, very happy that you mentioned that, because it is an area that has often not been given the attention that should have been given. It is a priority for us. Especially, we have seen the impact of the pandemic, but not only. And we are closely working now with our member states in order to find actions in the member states which can then be used in other member states to show good practice, especially with young people. So these are areas we are working continuously in. And what I can assure you is that we are dealing with COVID-19 and the pandemic, but at the same time, we are not taking our eyes off all the other areas which are so important for public health and for health within the EU.
Thank you. And finally, I would like to ask you about misinformation and disinformation on vaccines, but also I would like to ask for your message to the people who following the disinformation threads in their bubbles, for example, often driven by irresponsible politicians and country leaders who, for whom the vaccination's effectiveness is a matter of belief or all too often disbelief. What would be your message to the people that still haven't made up their minds as regards vaccinating against COVID-19?
My message would be to follow the science. I know, and I understand how tired people are, how often the messages can be confusing, how the pandemic has been now taking over our everyday lives, our working lives, for almost 22 months. I can understand the tiredness, and I can understand how everybody wants to go back to what we knew before. From the very beginning, I have said that what we say is follow the science. We read a lot, we see a lot on social media, but we need to understand also that we have the science and the numbers. And there is no doubt that the COVID-19 vaccines protect against serious disease, against hospitalization, and against loss of life. So we need to protect ourselves and protect those around us. And the European Medicines Agency, ECDC, and all the guidance that comes out are doing exactly that. We are following the science. And this is not about putting a political views first, but putting the science first. And citizens need to follow that in order to understand what they need to do now. Because sometimes we see so much misinformation and disinformation in social media that it can be very confusing for citizens. So I think it's very important that they have access to credible, coherent information from scientists within their member states, which have clear messages, clear communication about what they need to do. And the best way we can protect ourselves and others now is to be vaccinated. And until we have a high level of vaccination protection, to follow also the non-pharmaceutical measures where necessary. Mask wearing and social distancing. We have said this for the last many weeks, that it's not a time to be complacent. We are facing a new situation, a challenging situation, an increased number of cases. We have safe and effective vaccines. We now have approved therapeutics, which are going to be very supportive, but we also need to be taking other measures into account until we are over this pandemic.
Thank you, Madam Commissioner, for your important and wise insights. Have a good day and see you the next time.
Thank you.
Thank you.